Welcome back to Morning Break, and this week's Monday Motivation is brought to you by Gates Brain Health. Now, Dr. Randall Gates is a board-certified chiropractic neurologist, and we are so excited that he's so willing to come on the show and talk with us every 3 weeks. We love having you, so thank you.
I think this time it was 2 weeks.
2 weeks,
yeah,
back to back, pretty much.
I
know, love it. And what's so great is that we're learning about diseases that are really impacting people's health that they might not even know they have because they're more obscure. They're not as common as people think. So that's what we're talking about today, Meniere's disease.
Yes.
Let's just kind of start with the basic overall of what that is.
I should have brought my little inner ear, but basically envision 3 little hula hoops that have fluid in them where it's swelling, those hula hoops are swelling and not draining as well. And then envision the hula hoops attached to a conch shell. And that area might swell too.
So when I think of inner ear, I think of like swimmer's ear and stuff like that. Are these at all related at
Swimmer's ear is actually more the external portion of the inner of the ear. Your standard ear infection is the middle ear. Where like a child needs to take antibiotics. And then we move farther in, and that's the inner ear.
So the further in you go, obviously, the less likely you are to know what's going on in the inside of your head. And so you may not even know that you have Meniere's unless you are aware of maybe some of these symptoms. Let's talk about those.
Yeah, well, I'd say once they start, most people are pretty aware.
They know,
because they're horrible. Meniere's is a horrible condition to have. Yeah, particularly if there's vestibular involvement. There is something called cochlear Meniere's, which mainly affects hearing and ringing of the ear, and they can have some dizziness. But your standard Meniere's, where there's the vestibular end organ involved, is awful.
It's awful. And is that basically what causes like dizziness? Or
Great question. So Meniere's patients, one of the most important things to realize is that they have attacks of vertigo. And it's not just vertigo for like 30 seconds where the room spins around you. It's oftentimes at least 20 minutes to several hours.
Oh my
Might be up to 4 hours long. So envision, you know, we've all been on a merry-go-round and that twirling, we feel, well, if that did not stop for hours,
oh my goodness,
it can lead to intractable vomiting. And more importantly, along with the pressure in the ear, we call oral fullness, ringing in the ear, the hearing loss that can go along with it, is the uncertainty of when one of these attacks is going to hit.
Wow, so you have anxiety probably built up.
A lot of Meniere's patients have anticipatory anxiety or PTSD, you could say it that way, or post-traumatic stress, as to when the next event is going to hit.
No, I can actually relate to that because as you and I have talked, I have migraines and stuff, and when they were really bad when I was younger, I was anxious all the time because I never knew when I was going to get it. So I'd have all these great plans and I was so excited, but on top of being excited for the plans, there was always that worry that like I might not be able to do it because of a migraine attack and stuff.
100%, exactly.
So are there causes or triggers of Meniere's?
Glad you asked. Genetics can play a factor for maybe around 7 to 10%. It's really cool that even the Mayo Clinic is acknowledging now that autoimmune disorders, so where the immune system attacks the body, or viral infections or allergic disorders, that's another one I don't think the Mayo Clinic's talking about yet, those are factors that are thought to drain the canal, so to speak, that drains the inner ear. So it's like a pipe that gets clogged.
And typically this is something that you find in older patients, although it doesn't really discriminate against age, but I think I read online 40
to 60,
Perfect. And then what are some treatments? I mean, it sounds like an awful disease, but you've got some ways that you can help.
Yeah, so the standard medical treatment is to go on a salt restriction diet. Lots of times diuretics are used to kind of bring fluid out of the body so there's less pressure in the inner ear. If that doesn't work, they may put an individual aside from like medications to mitigate the dizziness, like cortisone injections into the inner ear. But lots of times if that fails, then the question becomes, does the person have to have a surgery on their inner ear where they go and they cut the vestibular nerve, or they kill it with an antibiotic, or they just cut out the entire inner ear itself. So that's pretty demonstrative, and it may work, but it also may not work. So a lot of patients have a lot of anxiety about that who I consult with. And what I do is that, so there's a large body of evidence saying that Meniere's might have this autoimmune and or allergic mechanism. 57% of Meniere's patients have a skin scratch positive test to gluten.
Interesting.
That's so
gluten.
over half have a
Wow.
skin scratch test positive to gluten. Which is pretty interesting because that's not the most sensitive test to gluten. So are there other foods that are involved? Are there, I've talked about the mast cells. The mast cells are involved with allergies. Are there things we can do to calm them down? And then there's a whole viral infection piece too. There's a thought that viruses are proliferating in one of the areas of the vestibular nerve, and that's leading to Meniere's as well. So I work with patients naturally, dietarily, with supplements on this process, and you can watch some of our testimonials. We've seen some really interesting changes. I'm very passionate about it.
I can tell, and you've had great success too. While we won't ever say that there's a cure right now, there are ways to significantly reduce those symptoms.
Seems to be in some of the patients I've seen.
Yeah.
Yeah.
Okay, well that is
really
awesome.
And I've done a ton of YouTube videos on this. So anybody wants more information, watch my YouTube videos, Gates Brain Health.
Okay.
Just search Gates Brain Health, Meniere's disease, several videos pop up.
Oh, that's perfect. And I will make sure that then there is a link to our website on kolotv.com after the show, so you can go ahead and check it out. Maybe if other doctors haven't really been working out for you and you want to go ahead and make an appointment with Dr. Gates, all of his information will be online. So thank you so much, Dr. Gates, for being here.
Thanks for having me.
Anytime. All right, we'll be right back after this quick break.